present the topic of donor eligibility and determination. So first of all, we'll see the objective. In objective, I put introduction, selection of the donor, assessment of the donor, medical history based on the medical history, physical examination, and laboratory investigation. So first introduction in the hematopoietic stem cell transplant was the first investigated in the human during the year of 1950 century. The HLA was first established in 1968 by the World Health Organization, WHO, and HLA typing was the first performed by serology using the antiserum that was obtained from pregnant women. So first we'll see the introduction. The allogeneic hematopoietic stem cell transplant is the treatment of choice for the variety of malignant and non-malignant condition. So this aim of HSCT is to replace the patient hematopoiesis with it taken from the donor. And there is the three conditions how we should meet for the donor to be considered as the suitable donor. And the donor needs to be a suitable match, healthy, and the donor should be willing to donate as a donor. The donor should be willing to donate if HLA match and the donor medical history and clear. If the donor is willing to donate, there will be a problem. So donor can be related and or unrelated in the primary considered with the HLA compatibility if the donor to the recipient. And in fact, this is considered like the most important factors for the success of the transplant related to mortality rate. So eligibility of the HLA typing of potential related donor for umbilical cord. So they don't need umbilical cord. A future model must be over 18 years of age. The mother should be in the good health, and the mother should be pregnant without any complication. And before planning for the umbilical cord donation, so the mother should be registered before onset of labor. So we'll go to the next slide. Selection of the donor. So selection of the donor is based on the HLA, serology, CMV, IgG, sex, age, and blood group, and DSA if it's haplo. So first we'll see the point HLA. HLA is nothing but HLA is human leukocyte antigen. Human leukocyte antigen, this is located in the chromosome 6 and the indolus cell surface molecule which present antigenic cell receptors. So these genes are linked together like individually inherit half of the HLA alleles is the single link focus from each parent, making each child haplodentical to the parent. Because a person inherited one HLA cluster from the parent, the sibling with the same parent have the 25% chance to be a match with the potential HSCT recipient. So this is more understand about HLA. There are two classes of HLA. There is class 1 and class 2. In class 1, HLA will be HLA-A, HLA-B, and HLA-C. In class 2, HLA, it's HLA-DRB1 and DQB1 and DPB1. So the most histocompatibility complex for the molecules. So in the class 1 HLA and the class 1 HLA molecules are present in the surface of all the nuclear cells and the platelets endowed by genes are the HLA-A, HLA-B, and HLA-C loci. So the class 2 are present in the molecules are present in the antigen is presenting in the B cell macrophages and then dendritic cell and Langerhans cell. So in HLA match can be performed at the antigen and the allele level. The allele level is more accurate in this attempt for the high resolution of typing. So because increase of HLA mismatch between the donor and recipient is increase the post-HSCT morbidity and mortality. So allele level mismatch negative affect the survival increase. Mostly they will increase of the risk of GVHD. So a HLA matched sibling donor is considered as the optimal HCS donor in the allogenic HSCT. It is associated with the lowest risk of GVHD and graft rejection. Once the suitable HLA matched donor has identified, so the donor must go on to the complete medical evaluation prior to donate the bone marrow. So here I have kept some slide. Fully matched HLA report, patient and donor, HLA-A, B, C, D, R, B1, and DQ, B1. So this is for fully match. So this is for partial match. Partial match, HLA-A, B, C, D, R, B1, and DQ, B1. So next slide will go for the CMV serology. CMV IgG and negative and CMV IgG positive. So both the donor and both the patient and donor is negative to CMV is the best, but in Indian population is very rare to chance to get both for the donor and recipient negative. So CMV cytomegalovirus in individual become infected with the CMV is permanently to carry the survivor of the CMV infection. So just 1 second, sir. So CMV infection does not make the donor ineligibility for the standard blood transfer blood product donation, because especially some of patient there is a chance to get this CMV infection due to cellular product like PRBC and platelets transfusion, because leukocyte reduction can be will remove for the HSCT, and hence the CMV positive cannot be made CMV negative as they've considered option for both donor and the recipient. So next slide will go for the blood grouping. So blood grouping, there are 3 types in the blood grouping. Minor ABO mismatch, major ABO mismatch, and bidirectional ABO mismatch. If the minor ABO mismatch, so 3 months prior we need to transfuse the donor blood type, and then if major ABO mismatch, will send the anti-A titer or anti-B titer. So based on the gender and age. So gender and age, male to female is gender match related donor, donor, and female to female gender match donor, and male to female is the risk for rejection, and female to male is the risk of GVHD. Age, donor age being preferred the young donor because compared with the older donor. So next slide is DSA. So DSA, this is used for haplo. So next slide will go for assessment of the donor. So assessment of the donor is based on the medical history. So we are taking the history of the donor. Currently, like if they are taking like major medication, or they having infection like viral or any other infection. So here I have put like, have you ever saw, this is question from the donor questionnaire. So have you ever suffered from any of the following, like abnormal bleeding or lung disease, heart disease, fainted spell, epilepsy? This all the history we have to take. So vaccination history. In the last 2 months, like this is question, like you have been vaccination on for the cholera, typhoid, diphtheria, tetanus, and did you have any major surgery, and did you have any measles or here next slide will be the asking question, especially for the female donor above the 18 years of age. So pregnancy, lactating mother, miscarriage. For the woman donor, we are asking the question of, are you pregnant? Have you been aborted in the last 6 months? Do you have a child less than 1 year old? It is the child still breastfeeding. So this all the question we need to ask from the woman donor. So based on the surgical history, major or minor surgery, history of the blood transfusion. So physical examination of the donor height need to be checked, and weight. If we prefer the donor, the weight should be above 10 kg. Any physical formalities. And then lab investigation of the donor investigation, HLA, we have to send HLA confirmatory, HB electrophoresis, CBC, LFT, RFT, CMV, IgG, and blood grouping, serology, Mantex stool, routine, ferritin if required, and X-ray if the donor is older, and the pregnancy test if the donor is in pubertal age, and DSA if haplo. So based on this, like if we are selecting for the donor, so based on the HLA, we have to take the HLA consent, donor consent, PAC consent, procedure consent, and the donor history questionnaires. So the number of stem cell source, volume collected, the bone marrow, we are collected like 10 to 20 ml per kg, peripheral blood 150 to 400 ml, and umbilical cord blood 80 to 160 ml. Hello, sir.
Hello. Sorry, I didn't know whether you were done with the slides or not.
Yes, sir, I have done.
Okay, okay, good. Great. Thank you, Ufika.